Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment.
The next thing is this. Like I said, you have your rec cards. Now, here's the funny part is this. Most agencies guaranteed have one brochure, just one. Now, the thing though is your brochure, what job is it supposed to be? Is it supposed to sell to a social worker, sell to a patient, or sell to a physician? The funny thing is you should have multiple types of brochures because each one of those brochures should address who the potential person reading it. If I'm going after patients, I'm going to have a separate brochure just for patients to be able to explain to them what we do. If I'm going to go to a skilled nursing facility, I'm going to have a brochure meant for patients coming from skilled nursing facilities so that we can put a quick explanation of what to expect if they decide to use our services. We want to be able to talk to the people that is there right now. If I'm going to go to a hospital, same exact thing. This is for post-discharge from hospital. This is what we do as a home health agency. This is what we do as a home care company. And not just the features, but this is how we can help you as a person when you leave the hospital. If I'm going to go to an assisted living facility, this is what we do. You can put some basic explanation of the step-by-step process on how easy it is to work with your company. If you're working with a physician, same exact thing. You want to be able to give an explanation of what are the steps that they're going to be able to experience when a patient gets referred to a home health agency, a non-medical, or a hospice agency. So you shouldn't just have that one brochure. You should have one brochure per facility you're trying to target. And you should have a brochure later on, we're going to talk about is when you're trying to target the social worker. Because the social worker does not want to see your brochure and it's going to be talking about the patients. What can you do for the social worker? So you should have rec cards that are based depending on the patient where they're from. If they're coming from the hospital, you should have a post-hospital discharge brochure for your home health, your home care. If you have a patient coming from a physician referral, you should have a brochure just meant for that. So this is what you can do to make yourself stand out. And I will guarantee you right now, maybe 99.9% of you watching this video do not even have that set up. Now, remember, we're talking about what marketing collaterals you have when you're coming into these facilities. The next thing is we talked about the rec cards meant for the patients, right? Now we're going to talk about rec cards or even 8.5 by 11 brochures, full colored, CMYK, meaning full colored, multiple colors, right? You just don't want a black and white thing, designed correctly, where we'll actually hire a nice, good graphic designer to make it nicely done. Now we have an 8.5 by 11 brochure that explains our services to a physician. Because we now want the physician to see why is it valuable to work with our agency for their patients. This brochure is meant for the people in the office to educate them about our services. You should also have 8.5 by 11 nicely made design for a social worker at a hospital, social worker for a nursing home, right? So these are things that you should actually have. If you don't have the basics of these things, how can you explain? You can't just walk in and say, here's our brochure. And just have that one brochure that is supposed to speak to everybody. That's what we call vanilla marketing. We're trying to spend our money, trying to limit our spending. And so we want to see that we can actually reach out to everybody with just one marketing collateral. When what you need to do is you need to be more specific on who you're targeting. If I'm talking to a social worker from a nursing home, I want to be able to speak how I can help this social worker with their patients. If I'm trying to talk to the patient and their loved ones in a nursing home, I want to be able to speak to them directly by using my marketing collateral correctly. You have to understand it's something different that you have to create. Now, look, I'm not going to say print 1,000, brochures, to be meant for the doctors or social workers. For that kind of stuff, the 8.5 by 11, you can actually purchase a nice laser printer. Now, if you guys hear the word, it's called a laser printer. I'm not talking about inkjet printer because inkjet printers, when they print, it's a little bit wet and it's not as nice as a laser printer. So if you want to make these marketing collaterals, then have a nice laser printer. You can get a decent colored laser printer for under $200, and the ink that comes with, the toner that comes with those printers can do about 2,000 prints before you have to buy the full toner case.
Brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.